Hey everyone, Jen here with
Daisy. Hi, everyone.
All right, y'all. So driving. You guys know we do this the best, right? We're on to another location. If you see me driving, typically moving from one place to the next, right? We're on our quarterly doctor tour. And so we wanted to share with you all what exactly that entails, because this time it's a little bit different. So as you know, when we do our quarterly doctor tour, we're going to different locations that are with us for patient care. So we take care of these people. These are businesses, and we go to their location on site, and we're doing, their drug screening. So random drug testing for, certain employees. And then additionally, we do all of their physicals, but for CDL drivers. So those are the big trucks, the truck drivers. Anyone in their company that needs within that quarter. So this quarter, we're talking about April, May, and June. We're going to do all those so that they remain current. What's cool is that there's no lost time from work. Super efficient. We get it all done there. And the employee can go about their business, right? They can just come in after their shift, go home, come before their shift, whatever works for them, we're there. But what's unique for this one is that we're also doing their annual safety training. And this is the big push, which is really cool because what we do is for this one, we're actually doing basic first aid and AED training. And I'm going to let Daisy touch on the AEDs here shortly. But the basic first aid is really cool because it's just to show them kind of workplace injuries, who they would call, notify, what they can do to help themselves or their buddies out, but also emergencies. Emergencies are important. So I know I need to call 911, but how do I recognize things like a stroke, things like a heart attack? Maybe someone has had, a seizure, right? So all of those things, what do I do? How do I identify it? Who do I call? Those are important things. What is also really neat is that, I have two more things before Daisy comes on. One is that when we initially came into these companies or brought on, to work with them, that was one of the assessments that we did, is that they have a very large footprint. And we noticed that if there was an emergency, it would be really difficult. One, it would take a long time for EMS to get there, but also they had no equipment, meaning AEDs. And so that's where this initiated from, was that we assessed the company. We said, you know what, this is what you guys need. They listened to us. They brought all of these AEDs in, and now this is what we do, is we come in and we make sure that they're certified as a bystander. Again, that's Daisy's expertise. She'll explain that to you, of how to use them. Okay. But the other thing, and we're going to show you guys this, we obviously driving, we can't, pull these out, but we're so excited because those people that are with us, those families, that are enrolled with on-site medical care, because a lot of the things we do is remote. We think it's very important that you're able to take vital signs at home. So we have created a remote patient care kit where they will be able to send us, information that we need: blood pressure, temperature, oxygen sat. And I'll have to show you this new device because it's super, super cool, especially for those kiddos, ear infection, strep throat, those types of things. We're able to see that. They can send a picture back to us, and it just is more efficient. It's just better care for the patient. We don't have to send them to the urgent care or emergency room where they're wasting their time and spending money. So we're super excited. New things coming from on-site medical care to our patients, to provide better care to all of you. So now I'm going to turn it over to Daisy, and she's going to explain all that she does with this AED because she is the subject matter expert. There you go.
So, hi, guys. So, as some of you know, I am a CPR instructor through the American Heart Association. So, teaching is my thing. I love to teach people how to save lives. And so, but what we did today was a little bit more basic, right? Because I wasn't doing a CPR certification. However, it is so important to know how to use an AED, especially where you work. be familiar where it's, where it's located. Make sure it's working. Make sure you know how to use it. And you don't have to be CPR certified to know. It's very basic, right? These AEDs, it stands for automated external defibrillator. And so what that does, it is life-saving. It is once it's applied correctly, it is going to shock the heart to be able to bring it back to normal rhythm. And so today was really important to teach the gentlemen, and ladies also, first, where it's located. Second, how to, get it to start working. And once you turn it on, it's so neat because it guides you through every step of the way. And so you feel confident. As long as you follow those commands, you're going to be able to save a person's life. So those things are very important. Oh, sorry guys. The sun is like really here. Probably can't see me. Okay. So it is really important to make sure that we teach them because these things are, they're life changing. Just imagine if you were the one that would need this, AED and no one around you knew how to put it on. That's a problem because we don't know when EMS will arrive. And obviously while we're doing this, we're also doing compressions and we're hoping that EMS will arrive soon. But in the meantime, we want to make sure that we're working towards saving your life. So it was really interesting. It was great training and we had everybody do hands-on, which they really enjoyed. And after the class, we asked everyone, are you confident now to be able to apply an AED on a victim and be confident in knowing how to save their life? So it was a great training. We enjoyed it and we had great feedback after the class. So now we're going on to our next location to teach some more people how to use an AED. All right.
Yes, y'all. So, my last thing with this is, what we do is very unique. Us coming to companies, to location, on site, to be able to provide this to your people. So if you think that you would benefit from this, definitely reach out, let us know, because this is what we're great at. We get in the vehicle, travel to where we need to be. If you can see in the back, we have our luggage, we have all of our supplies, we have everything that we possibly need to do these classes efficiently, professionally, all the things. And of course, ourselves with our brains, most important, right? And so we love it. There's nothing that beats this. And I think if you've ever experienced on-site medical care, whether it's myself, Bree, Daisy, Clay, Dr. Shneshkoff, any of us, you know that we're providing top-notch care. So we look forward to talking with you.
That's right.
See you soon. Bye.
See you soon. Bye-bye.